Hello, and welcome to Primary Care Physicians and Early Diagnosis of Lupus. I'm Annika Hazlitt, a member of the Board of Directors at Kaleidoscope Fighting Lupus, and your host. Lupus is an incredibly complicated disease to diagnose, and often primary care physicians are the first to identify the symptoms. Today, we are fortunate to hear from Dr. Emily Puukka Clark, a primary care physician. Dr. Puukka Clark will describe why diagnosing lupus is so difficult and how she, as a PCP, approaches these challenges so that an accurate lupus diagnosis can be made as early as possible. And because primary care physicians are likely the first to notice lupus symptoms, Tatiana Spiegler, a registered nurse and patient engagement liaison with GSK, will give us an overview of both lupus and lupus nephritis for the newly diagnosed. Before we hear from our experts, I'd like to thank our presenting sponsor, GSK, for their generous support in making this event possible. I would also like to thank our community partners, 7 Minute Cinemas and Blue Eyed Crow Studio, for their support. Now, let's hear from Dr. Puukka Clark.
Hi, my name is Dr. Emily Puukka Clark, and I'm a primary care physician in the field of family medicine. My practice is in Tigard, Oregon, which is a community just outside of the Portland area. In my career thus far, I've had the opportunity to care for many patients with lupus, and I'm very happy to be here to talk about lupus and lupus nephritis in the primary care setting, and to focus on some of the challenges that this complex disease can present to both patients and their physicians. Lupus is a chronic autoimmune disease that primarily affects young women of childbearing age and is more common in certain racial and ethnic groups, especially Black, Asian, and Hispanic populations. Autoimmune diseases occur when a body's immune system mistakenly identifies its own healthy cells as foreign and attacks them. Some other common autoimmune conditions include diseases like rheumatoid arthritis, multiple sclerosis, celiac disease, type 1 diabetes, and many others. As is the case with many autoimmune diseases, lupus can manifest quite differently in different patients. This means that patients don't always have the same set of symptoms or the same severity of symptoms. This can present quite a challenge in identifying the correct diagnosis in a timely manner and initiating the appropriate screenings, treatment plan, and follow-up for a patient. Lupus can affect almost any organ of the body, and what organs are affected and to what extent can change throughout the course of the disease. Symptoms that are present at the time of a patient's initial diagnosis can vary quite dramatically from person to person. In addition, symptoms at the time of the initial diagnosis can range from mild to severe and even life-threatening organ involvement. One challenge in diagnosing lupus is that there is no one single test to make or confirm the diagnosis. For some conditions or disease processes, there's a single blood test or imaging study that can definitively confirm a diagnosis. For lupus, the diagnosis is made based on overall clinical suspicion. This is influenced by a patient's symptoms, personal and family history, physical exam findings, supporting lab data, and the exclusion of other alternative diagnoses. There are some diagnostic criteria and classification systems used, especially by rheumatologists, that can be helpful in this process. To further complicate things, patients often present with only a few clinical features of lupus, and these can often mimic other autoimmune, rheumatologic, or other diseases. There are many blood tests that may be a part of a workup if lupus is suspected, but there is one particularly important lab test to mention. The test is called ANA and is a measurement of anti-nuclear antibodies. This type of autoantibody is a prominent feature of autoimmune disorders and virtually all patients with lupus will have a positive ANA test, though this can vary at different times in their disease course. It's also important to understand that this test must still be interpreted in relation to other clinical features. Almost 15% of the US population has been found to be ANA positive, but only about 10% will have a true underlying autoimmune disorder. If the ANA test is positive, there are some additional autoantibody tests that can be performed and can help further clarify a diagnosis. I want to spend some time talking about the most common symptoms and manifestations of lupus. Fatigue is the most common symptom of lupus and is a very common symptom generally. Studies have suggested that 80 to 100% of patients with lupus experience fatigue during their disease. Other common constitutional symptoms include fever and weight loss. These symptoms, especially fatigue, are quite common symptoms that can be associated with many other disease processes, and thus these can be easily missed as early symptoms of lupus. Arthritis and associated joint pain occur in over 90% of patients with lupus, and these are often among the earliest disease manifestations. The arthritis associated with lupus is inflammatory, which means that joints may be swollen, red, and hot. This is an important distinction from osteoarthritis, which is the arthritis of aging and degeneration, and typically doesn't present with these kind of inflammatory exam findings. Joint pain related to lupus tends to involve multiple joints. It can affect different joints at different times, and it's usually symmetric, which means, for example, if a patient's wrist joints are involved, it will likely affect the wrists on both sides. Skin and mucous membrane lesions are also common in lupus, but there is significant variability in how these can present from one patient to another. The most common skin finding is the butterfly rash, which is a distinct, deep red facial rash over the cheeks and nose. Some lupus patients will also develop discoid skin lesions, which are usually round or disc-like, and they're inflammatory skin lesions that tend to leave significant scars. Cardiac or heart disease among patients with lupus is common and can involve any part of the heart anatomy. The most common cardiac manifestation of lupus is pericarditis, which is inflammation of the lining of the heart. Sometimes this is associated with fluid collection around the heart called a pericardial effusion. It's estimated that about 25% of lupus patients will experience this condition at some point in their disease. This diagnosis is made on a study called an echocardiogram, which is like an ultrasound of the heart. Kidney involvement is common in lupus and often presents early in the disease course. Lupus nephritis is a kidney condition where autoantibodies, or antibodies that inappropriately target a patient's own cells, attack part of the filtration system of the kidneys. This can cause inflammation in the kidneys, and in turn, this can lead to protein leakage in the urine, blood in the urine, elevated blood pressure, and abnormal kidney function. In some cases, this can even lead to kidney failure. Most patients with lupus will have clinical evidence of kidney disease at some point in their disease course. It's estimated that about 10% of patients with lupus nephritis will develop end-stage kidney disease, so identification of the early signs of nephritis is very important. The time course for the development of lupus nephritis varies with patient sex, age, race, and ethnicity. Data show that males, patients who are younger at the time of diagnosis, and patients of color are at increased risk for developing lupus nephritis earlier in the course of their disease. Studies have also demonstrated that Black and Hispanic patients tend to present with more severe kidney disease at the time of their diagnosis and have a worse prognosis than white patients. At least annual screening with urinalysis and blood tests related to kidney function is important for all patients with a diagnosis of lupus, but this is especially critical for these higher risk patient groups. I've mentioned several of the most common organ systems affected by lupus, but it's important to understand that there are other common and potentially serious manifestations of lupus in the lungs, gastrointestinal tract, blood cells, vascular system, eyes, and truly almost every other part of the body. If you have lupus or have symptoms that you think might be related to lupus, be sure to speak to your primary care physician to ensure that you are undergoing the appropriate evaluation and screenings. As a primary care physician in an urban setting, I'm very fortunate to have many local specialists that I can involve in my patients' care as needed. It can be incredibly challenging to ensure that all of the indicated care and follow-up for a patient with lupus is identified and done in a timely manner. Specialists can be absolutely invaluable in helping to manage this care and offer their own unique expertise to benefit the patient with lupus. It's important to realize that patients living in rural settings may not have the same access to specialty care. They may need to rely even more on their primary care physician to help guide and manage their diagnosis and chronic disease management. Thankfully, even when based in a rural area, there are usually ways to help involve specialists as needed, and patients should feel empowered to discuss this with their primary physicians. To conclude, lupus is a very complex autoimmune disease that can be difficult to diagnose, identify early in the course, and can be challenging to manage. There are manifestations of lupus in virtually every organ system, and early detection of lupus complications like lupus nephritis and others is critical to improving outcomes. The primary care physician is often the first physician that a patient will talk to about symptoms, concerns, fears, and questions. I encourage you to find a primary care physician who listens well and is acting as a partner in your health and care. Thank you for your time.
Thank you, Dr. Puukka Clark. That was some great information. Next, we'll hear from Tatiana Spiegler, who will provide an overview of lupus and lupus nephritis, as well as some great resources that you can use to help deal with the challenges you might face before and after a diagnosis. Welcome, Tatiana.
Welcome. I'm Tatiana Spiegler, a Patient Engagement Liaison with GSK. Today we'll talk about some of the basics of lupus while focusing on systemic lupus erythematosus, or as you might have already heard people call it, SLE. And we'll also be talking about lupus nephritis, one of the complications of lupus that involves the kidneys. Keep in mind while you listen to this presentation that it does not take the place of talking with your doctor about your symptoms or treatment options to manage your lupus. And there are 5 topics that we'll cover today. We'll start with some of the basics of lupus and the immune system before going over some of the common signs and symptoms of lupus. We'll also talk through lupus nephritis, including symptoms and what happens inside of the kidneys. And we'll also mention the lupus lifestyle. Thank you all for being here today. It's very important that you're all here today. Educating yourselves is the first step in proactively managing your lupus. And you're doing just that. Well, there are a few types of lupus. We're going to focus on the one that's the most common, systemic lupus erythematosus. Lupus is an autoimmune disease. It means that your immune system attacks its own healthy tissues, which is what causes inflammation and pain. And this could lead to damage to any parts of the body. Lupus is also considered a chronic illness. This means that as of right now, there is no cure, but there are treatments and lifestyle practices that can help you control symptoms and prevent damage to your body. Lupus is characterized by flares and remissions. Flares are periods during which you may feel worse, and remissions are periods where you may feel better. Remission can last from a few weeks to years, where your symptoms are well controlled. There are about 1.5 million people in the US who are living with a form of lupus. with SLE being the most common form. There's also cutaneous lupus that affects the skin, drug-induced lupus that is triggered by a medication, and neonatal lupus in newborns, just to name a few. Women between the ages of 15 and 44 are more likely to develop lupus. Lupus is more common among women of color, including African American, Asian, and Hispanic ethnicities. In fact, 90% of lupus patients are women, making men 10% of lupus patients, or as we can see here, 1 out of every 10 lupus patients are men. The cause of lupus is unknown. Scientists believe that it may be a combination of things between hormones, genetics, and the environment. And to better understand how lupus affects the body, it's important to understand the immune system. Our immune system acts as our security team. It protects our bodies by recognizing anything that shouldn't be in it, like germs, bacteria, and viruses, which is very, very helpful. Our immune system fights off these invaders, and one of the ways that it does it is by creating antibodies against them. In the body of a person with lupus, their immune system cannot tell the difference between foreign invaders and their own healthy tissues. Essentially, the body mistakenly attacks itself, causing inflammation, pain, and damage. Lupus signs and symptoms are the result of this autoimmune response. Because our immune system protects every single part of the body, lupus can affect any body part. And you can see here on this slide the body parts that are commonly affected. Some of these symptoms are easy to spot by just looking at a person, and these we call visible signs of lupus. But one of the hardest things about lupus is that many times a person with lupus does not look any different, or they may not physically look sick, but they don't feel good in the inside and they struggle to live their usual lives. This is because lupus symptoms can occur in the inside of the body. These are more serious signs that only you and your doctor can recognize. The way that lupus affects a person's body is unique, which means that the signs and symptoms of lupus are different for everyone. Not two people are going to present with the same symptoms, same severity of these symptoms, or have the same effects. Let's discuss a few of the most common signs and symptoms of lupus. As we talked about before, some symptoms of lupus are visible on the outside of the body. For example, weight changes, hair loss, joint swelling, mouth or nose sores, and perhaps the most notable one, the skin rash. One of the most identifiable symptoms of lupus affecting the skin is a butterfly rash on the face. It goes over the bridge of the nose down to the cheeks. And then we have the invisible signs that are more serious as lupus is affecting the body from the inside, where we have major organs. If the inflammation caused to these tissues is not controlled, that can cause damage that is eventually irreversible. Signs of organ damage can include blood or protein in the urine caused by inflammation in the kidneys, or if lupus is affecting the heart, it can be felt as chest pain. And these are just an example. The key concept here is to keep track of your symptoms, no matter how small you might think they are, and discuss them with your doctor so together you can identify ways to monitor the progression of these symptoms and come up with a plan to prevent complications. Fatigue is one of the most reported invisible signs of lupus. As many as 80 to 90% of people living with lupus experience some level of fatigue. This is extreme tiredness through the whole body that does not go away with sleep. It may be as subtle as struggling to get out of bed in the morning, or as severe as having no energy to attend a family gathering or getting things done in the house. Lupus can also have neurological effects, including headaches, depressions, seizures, strokes, or neuropathy, which is numbness in the extremities. And keep in mind that this is not a full list of the invisible signs of lupus. Brain fog is another common symptom of lupus. In fact, 50 to 80% of lupus warriors may experience brain fog. It causes issues with memory, concentration, and attention. And yes, we all forget things, but pay close attention if you're feeling confused after a conversation, or maybe you're having a hard time concentrating, like inability to sit down and read a book, or maybe watch a TV show. Or you might just start a task and not finish it, so make sure that you're keeping track of all your symptoms. And this is a post from our Us in Lupus Facebook page by a lupus warrior. Lupus is definitely an invisible disease. Through it all, we have to keep pushing. This is a reminder that you are not alone in this journey, and it's important that you find support from other people living with lupus. And now let's move on to lupus nephritis. That's when lupus causes damages to the kidneys. It's one of the complications of lupus and one you need to proactively monitor. So let's start with the basics. When lupus affects your kidneys, it causes inflammation in the kidneys that prevents them from working properly. If the inflammation is not controlled, that causes permanent damage that leads to kidney disease. We see patients that get a lupus diagnosis because they come in and they get diagnosed with lupus nephritis. We also see patients that have been managing their lupus for a while and their kidneys end up being affected. In fact, about 35% of newly diagnosed adults with SLE already show signs of kidney involvement. Over time, as many as 40% of adult patients living with lupus will develop lupus nephritis. And in children with SLE, up to 3/4 may develop kidney involvement. Patients with SLE who are African American, Asian, or Hispanic are more likely to develop lupus nephritis or lupus-related kidney disease. In addition, men with lupus are more likely to have kidney involvement that progresses to lupus nephritis. When we think of the kidneys, we think of them making urine, but they do so much more for our bodies. Their function is essential in keeping our bodies working. They remove waste and extra fluids from the body, help control blood pressure, create new red blood cells. They help keep your bones healthy and maintain the right pH levels in your blood through healthy balance of chemicals that control acid levels. In kidneys that are affected by lupus, inflammation leads to damage and scarring that prevents kidneys from doing their job, like removing waste and controlling fluid levels. As lupus nephritis develops, there are some symptoms that you can watch out for. Swelling in the feet, ankles, legs. Swelling can also happen in the hands and in the eyes. High blood pressure, so make sure that you're monitoring it regularly. Changes to your urine, like changes in color, that can mean that there is blood in the urine, or foamy or frothy urine caused by proteins in the urine, which is abnormal, and an increase of need to urinate, especially at night. Remember that these are some of the possible symptoms of lupus nephritis, not all, and it's so important that you're tracking and reporting them to your doctor. Lupus nephritis disease progression is categorized into classes. The classes are based on kidney biopsy findings that can help doctors determine the severity of lupus nephritis. The best place to start to understand your own risk for complications is by having a conversation with your doctor about what to look for and what tests they can run, and also review your symptoms. If lupus nephritis is left untreated, it can cause permanent damage to the kidneys, and then the kidneys can't work properly. And that's what we call kidney failure or end-stage renal disease. The only way to filter the blood or remove fluids and toxins is by dialysis treatment and eventually a kidney transplant. As many as 20% of patients with lupus nephritis will progress to dialysis treatment or kidney transplant within 10 years of a diagnosis. And while that percentage may seem small, it's important to be proactive in your treatment plan. And I cannot highlight enough how important it is that you talk to your doctor about lupus nephritis and how lupus can affect your kidneys. Caring for yourself and your lupus is something called a lupus lifestyle. As lupus affects many parts of your body and your life, you may have gotten into new routines, or maybe you've changed the way that you do things. Lupus becomes part of your daily life in many ways. At home, you may be monitoring symptoms, getting the right nutrition, and taking time to self-reflect. As you meet with your doctor and continue to manage your lupus, you may be communicating very openly about your experience, getting tests and treatments, talking to specialists, and staying informed. And to help you keep learning about lupus and the lupus lifestyle, I have some free resources for you all. Here we have some QR codes that take you to the Ask in Lupus site. These resources can be very helpful in the management of lupus, and there's also information for those who care or support someone with lupus. You can also come check out the Patient Engagement Liaison nurses at the gskplacehub.com for some live webinars. Lastly, I want to express my sincere appreciation for your attention during this presentation. I truly hope that you found something useful for your journey managing lupus. Thank you for being a part of this incredible learning experience.
Thanks for all that great information, Tatiana. This brings us to the end of primary care physicians and early diagnosis of lupus. We hope you found this information useful and empowering. Once again, a special thanks to our presenting sponsor, GSK, for their generous support in making this event possible. We would also like to thank our community partners, 7 Minute Cinemas and Blue Eyed Crow Studio, for their support. And we want to thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, award-winning blog articles, and so much more. Thanks for spending time with us, and remember, you are not alone. I'm Annika Hazlitt for Kaleidoscope Fighting Lupus. Please take care.